Yes. Hi, thank you for joining us today for the Pitkin County community meeting around the evolving COVID-19 incident impacting our community. I'm Tracy Trulove, the Pitkin County Incident Management Team Public Information Officer. And today I'm joined around the table with Tom Heald with the Aspen School District, Karen Kenneman with Pitkin County Public Health, Mike Kaplan from the Aspen Ski Company, John Peacock, the Pitkin County Manager, Dave Ressler from Aspen Valley Hospital, and Gabe Muethling, the Aspen Ambulance District Director and working under Unified Command in the Pitkin County Incident Management Team. And that Unified Command structure is Karen Kenneman, Gabe Muethling, and Alex Bruschetta. From a policy perspective and for our community, I want to share a few things about where we're at today. And there's several things that are kind of standing out there in our community. The first thing is a standing public health order, and that prohibits events over 50 people and sets requirements for events under 50 people. What we'll have for you at the end of this call is a tremendous amount of links and information that you can get to go a little bit deeper into that conversation. There are also, the city of Aspen had a state of emergency that was issued on the 12th of this month. And as we all know, the Colorado governor's order to close the ski mountains was issued yesterday. What elected officials are working on currently is to strengthen the social distancing measures in our community. And again, this distinguished panel of people I have working with me today will help answer a bunch of those questions. But that's the format of this. We're going to kind of give you a broad overview and then go into a very succinct question and answer session based on the questions that you've sent in. We were not able to get to all of them. We appreciate all the questions that did come in, so just know that we will start standing up more documents to answer the questions that we can provide answers to. So the second part I'd like to kind of touch on is what organizations and businesses can do currently in the response that we're in. We need to have you take the responsibility to create a plan for your organizations to respond to COVID-19. That could be everything from the immediate health and safety for employees, a plan to do that, telecommuting policies, cleaning and personal hygiene policies, sick leave policies, or unemployment policies. So again, we're really asking businesses to take a first stab at how they're protecting their employees, their teams, what they need to do. And then recognizing that our team is also looking at ways that we can support your planning. And that's all being built out. I mean, recognizing we've been in this for a week, just about a week. The last thing I really wanted to touch on was what you can do as an individual. So all of our individual actions matter right now. If you're sick, stay home. If your symptoms are getting worse, contact your care provider, and if there is that need to call 911, those systems are still in place and operating. Social distancing is the best strategy to slow the spread of the virus and spread the impact off of our local healthcare system, which will save lives in our community. Again, we're going to constantly be providing you information on what this means, but we're actually trying to really do this in a coordinated fashion as a community response to what we're witnessing right now. There's a couple things about that. Stay home or in unpopulated places as much as possible. Work from home if you can. And also that stay at least 6 feet away from other people. For our community, I saw a graphic the other day that said that's about a set of skis. So if you need a visual for our community, there's one for you. So with that little overview, what I'd like to do now is open it up to our panelists for their question and answer period. And again, these were questions that you provided us from the community that we are doing our best to kind of get a thematic approach to and answer. So I'm going to go ahead and start with Dave from Aspen Valley Hospital. Dave, did I even introduce you or did I skip over that part?
You got me.
I got you. Okay. Don't want to forget you. So share with us, what is the availability of testing?
Well, I think in order to answer that common question, it might be helpful to frame the answer in the context of the availability of testing and the prioritization that's been established by the state lab. This lab is operated by CDPHE, which is the Colorado Department of Public Health and Environment, and they can only process 160 tests a day. And so they have established 3 priorities. The first priority is workforce, and there's actually some guidelines that they're going to be issuing, and I'm talking about healthcare workers in particular to be able to address this situation. The second priority is critically ill patients, and this is really where our services come into play at Aspen Valley Hospital. This is for patients very specifically that are critically ill and that are hospitalized. That is what the lab is prioritizing, being able to perform these tests for. It's just one more tool in the toolbox for the physicians to know whether or not these patients with severe respiratory conditions actually have the COVID virus, the coronavirus. The third is for epidemiological purposes, and that is what is commonly referred to as community testing. I think Karen will probably speak to this a little bit more. We here in this community had 2 days of aggressive community specimen collection for patients that had symptoms and have been sent to the lab, and we have not yet received those, or many of those results back, and I think that's over a week. That's testimony to the fact that the lab is really overwhelmed, and that's why they're having to prioritize. They're really focusing on the critically ill patients. So I would also add that there is still community testing going on, but it's in areas where they have not yet defined whether or not there's community transmission, and they're having testing centers still on the Front Range.
Okay, great. So I think you really did touch on that second one. Where can you go to be tested?
So back to for the critically ill, that's really where the hospital's role is. I think it's important to note that we should maybe reframe that question a little bit. Where should you go for care? That's really the question. If a person is having severe symptoms, difficulty breathing, feels like they're in respiratory distress, the hospital is the place to go. And at the hospital, if we feel like the patient needs to be admitted or potentially transferred to a higher level of care at a lower altitude, then our physicians will order the test.
Great.
So that's where the tests are being performed right now.
Okay, thank you very much. We're kind of still under that testing umbrella conversation, and Karen, I'm going to send this over to you. What is the extent of the spread here?
Sure, thanks, Tracy. And I'm going to piggyback off of what Dave was saying as far as the epidemiological component of testing. So we know that if we can do broad-based testing, if we had the full capability of doing that, that's one way of tracking the spread of COVID-19 through the community. In light of what Dave reflected, that there's limitations to that right now from an epi standpoint or epidemiological standpoint, we're going through and devising a new way of being able to sort of track spread within our community. And that's a system that we're devising and we'll be launching in the next few days, where we'll actually have people self-report in a kind of a Google Doc online format. And by having people self-report as far as their symptoms, what they think is happening, getting some basic demographic data, we should be able to track or surveil the spread of COVID-19 through our community in a different way beside testing. And so in lieu of broad-based testing, we're really looking at that as a way to track the spread of COVID-19. What we have to date is that we know we have 13 positive cases in Pitkin County. We receive data from the State Health Department every day on our current testing results. And so that's about noonish every day we get results back. We get results back from the State Health Department on positive cases. The provider gets results back on the negative cases. So because COVID-19, we call it a reportable condition, every provider has to report when they get those cases back, and public health always gets notified when we get positive cases. So we'll get those positive cases every day as the lab tests start to come back to us.
Okay, great. I know I'm coming back to you in a little bit, but I'm going to move the conversation over to what we're saying is requests for assistance. And John, this puts you in the hot seat. So are there any confirmed source of assistance that the county can share or provide, or where we're headed with that conversation?
Yeah, thanks, Tracy. And before getting into the details, I just want to step back for a second. The strength and resilience of a community is demonstrated during challenging times. Now is our time to pull together to show the state, nation, and world what a great community we are here in Pitkin County. This is an opportunity for each of us, all of us, to demonstrate our compassion, our patience, and above all, an unfailing effort to support each other. So I just want to get that out there. This is an opportunity right now. I know people have uncertainty. Some people are scared. This is an opportunity for us to pull together and show what a great community we are. To that end, emergency assistance programs are available for those residents that are experiencing a crisis that affects their housing, employment, health, or well-being. If you're in need of a helping hand, please check out our resource list at www.pitkincounty.com and search for emergency assistance. Under these programs, we have temporary aid for needy families, emergency assistance with childcare, housing, and food needs. For those in immediate need of food assistance, there are several avenues. If you're over 60 and in need of food assistance, the senior center, though the facility is closed, will deliver meals. If you think you qualify, please call 920-5432. Additionally, Aspen Family Connections is providing food assistance for families that qualify for free or reduced lunch or find themselves recently in need. That food assistance will become available tomorrow from 12:30 to 6 o'clock in the middle school parking lot. And again, that will be for qualified families. In addition, Food Bank of the Rockies will be continuing to provide their food assistance. They'll be at the El Jabel Community Center on March 18th at 11 a.m., Basalt at 111 Emma Road on April 2nd, and in Aspen at the U.S. Forest Service April 9th, beginning at 11 a.m. Some of the things we're really proud of right now, community foundations are working with local governments right now to set up additional relief programs, opportunities for community members to make donations to help those in need. We need a few more days to work out the details of those programs. Please check our website, www.pitkincounty.com. We also have an Aspen to Parachute COVID-19 hotline. That number is 429-6186. They will also have information on those programs as they evolve. Please check in with us in the next few days if you're in need of assistance. In addition, there are going to be a number of federal programs, assistance programs, and aid programs. They may be enhancements to existing federal assistance programs. There may be new programs. We have not received the guidelines from our federal partners yet, but those will be forthcoming. And again, that information will be available on the county's website or through the hotline at 429-6186. Thanks, Tracy.
Great, thank you, John. I'm going to move to a category that we're kind of talking about timelines and when will things open. And Karen, one of the questions I have is how far out are events impacted?
Sure. So per the standing public health order that we issued in conjunction with Garfield and Eagle counties, the public health order right now is staged until April 8th. Right now, we're going to be revisiting this public health order. The CDC just recently came out with their own guidance around mass events and or mass gatherings and events, and their recommendation falls actually in line with our recommendation of 50 folks or above. They have a recommendation right now for 8 weeks for that. It's not a order, but it's a guideline. And so we will be looking back at our own order to determine if we need to extend this out. But per CDC guidelines, they're looking at 8 weeks.
Great. I'm going to kick this next question over to Mike Kaplan. When will the ski slopes reopen?
Mike,
There you
see,
go.
you
Now
can't
you're on.
say that. You gotta say microphone with me. That is a good question. We will see. First, I just want to echo what John said. There's no place I'd rather be than right here. This community is made up of people who are resilient, compassionate, generous. We've seen it proven over and over again. One of us gets sick, and we're overwhelmed with the generosity. People come and rally, and whether it's donating funds or cooking meals for somebody, whatever it is. So this is the place to be, and I know I'm happy to be here. And also, isn't off-season our favorite time of year? Yeah. So off-season got a little longer this year. I don't know when it's going to end. We're taking it week by week, taking direction from this group, as well as the governor. Obviously, the order the governor issued to shut down ski areas is effective through this Sunday, the 22nd. If he lifts it after that, we're going to be doing a lot of talking around this room, and if everybody's comfortable, then we'll have some thoughtful, limited operations. Right now, what we've done is we've officially called it at Buttermilk, so crews are on the hill right now, tearing down the equipment and putting it away for the summer. The other 3 mountains remain on standby, and we will take it week to week. And again, be very thoughtful about that and collaborate with you guys. Finally, I just say in the meantime, we do have uphilling available on the mountains. We're trying to maintain some basic egress access. From personal experience, I'd recommend you don't go too early. It's a little frozen up there. And don't go too late. It'll be a little slushy. And most of all, just be careful. Keep it on the easy stuff, because we know how hard our first responders and our medical community is working, and we don't need to make their lives more difficult. That said, I think getting out and getting some exercise and some sunshine is important for all of us.
Great, thank you very much. So, Tom, I believe that there's going to be a lot of kids that don't care too much about this question, but a lot of parents that are very curious. So when will schools reopen?
Yeah, spring break started a week early for students and staff, so some of them are happy with that. I saw several vehicles today loaded up with bicycles headed west, so I imagine they're going riding. At this point, we closed school up through the 29th of March, with staff to return on the 30th, students to return on the 31st. However, as we all know, that could change. And we will continue to monitor transmission through this week and through next week, and try to have a message out to the community by midweek next week regarding whether we need to stay closed for a longer period of time. If we do stay closed for a longer period of time, you will start to see a lot more messages coming from us regarding remote learning, online learning, those opportunities. Messages were sent out this past week with resources for parents that they could begin to support learning on their own if they had the time and the inclination during these next 2 weeks. But again, if we find ourselves going into April, then in fact we will start to provide that service from the school side. For the younger grades, that might include paper packets as well. Just some other things that are in play. John mentioned our lunch program will continue, and I do want to thank the parents and the students and the staff for their generosity and just stepping up and helping with this and trying to get lunches out to everybody. So it's a wonderful thing to see the community gather together for that. We have had a number of our sports teams gather together and continue to practice. They have done that in groups less than 50, and we would continue to ask that they do that, arrive by themselves, and gather in groups less than 50. Give yourself a little bit of space. As kids will do, they will convene. So just be mindful of those gatherings. One other piece of advice. Some of our families may have handed off caregiving to their elderly members of the family, and I would just remind the students and the family members to practice self-care. Be mindful of washing your hands, covering your cough, practicing your distance, and ensuring the safety of all your family members.
I'm a mom of 3 teenagers, and so the social distancing conversation was very interesting in our house the other night. So thank you for that.
That it was.
Now I'm going to tell them to go watch it on TV because then they'll maybe really believe it. So let's move to the conversation on public health recommendations. And Karen, this is coming back to you. What are the recommendations for those who are currently not sick? Because, for example, drive elsewhere in the region, we're going to start to see this become a very statewide impact, I'm certain.
Sure. So just to continue to reiterate the message that for those folks that are not feeling any symptoms or feeling really well, to continue to do social distancing. And so I think just really it seems so simple to be thinking about the hygiene pieces, but to continue to practice those, to think about your distance from other people, but even to think about how you're going about your day. So maybe you go to the grocery store when it's early in the morning when there's less people there, to really think about, as Tom said, older adults and people that are most vulnerable to getting really sick from COVID-19. So people who have pre-existing conditions like diabetes. So protecting our most vulnerable folks in our community and really helping them. So don't keep your distance from folks that might be most vulnerable, supporting them. So if people need a food delivery or something like that, you can help out from a community perspective to really support folks in getting medicine or food for them if they're in that more vulnerable space. As far as, travel, to echo, getting outside, and if you're in a car with your family and you're going out into the backcountry, that's just that's a low risk activity. To echo what Mike said, though, we don't want to put our first responders and our healthcare workers at risk. So to think about sort of the risk level that you're doing if you're going outside. But to continue to think about like walking your dog around your neighborhood and keeping 6-foot distance when you chat with your neighbor as you're walking your dog is just a great activity. We want to also think about our mental health in component of this, and how do we continue to do things that support our mental health. And so I think as healthy people, to continue to support others, call your grandmother and give her a warm hug over the phone, and just to be really community minded and focused on how we can continue to do things that support ourselves while still keeping that social distancing in play.
So why are bars and restaurants still open is a question we have, and even stores.
Sure. So when we're revisiting the public health order that we established, and bars and restaurants are definitely one of the conversation pieces that we're having. It will probably come through a new order within the next day or two. And what we're discussing right now is for bars and restaurants to close the mass gatherings, because it probably really is hard to maintain social distancing in some of our restaurants, and to allow them to provide delivery service or pickup service. We certainly don't want to cut off food supply or any necessary services in our community, access to medicines, access to food, access to critical services. So how do we have sort of this balance between access to those types of things, as well as more of these closures to prevent gatherings together? So we are considering that right now, and probably see something to that effect in the next few days.
Great, thank you. John, I think there's going to be a couple engineering departments that are being curious about the answer to this question about, should construction projects halt?
Thanks, Tracy. Regardless of the industry, all employers right now should be paying attention to what Karen just talked about, which is social distancing. Whether it's in the workplace or in the community, the most important thing we can do right now is social distancing, and that's keeping 6 feet apart. For employers, it means having adequate hand washing and sanitation facilities so that employees can regularly wash their hands, and having the policies in place so that if an employee is exhibiting any symptoms that might be COVID-19, that they are encouraged and supported to take time off. If a construction project or any employer can meet those conditions and achieve social distancing, then there's no reason for business to stop. If the nature of the business is such that those conditions cannot be met during this public health emergency, then employers need to consider delaying or shutting that job or work site down.
Great, thank you, John. Karen, this one comes back to you. Who is monitoring those who are quarantined to ensure they do not violate guidelines?
Yeah, so pending the pending where people are from. So if it's a Pitkin County resident, the local public health department is checking in on people who are either quarantined or isolated on a daily basis. And the check-in is really to monitor their health and see how they're doing. And I just want to remind everyone that these are folks that are sick. It's not fun to be in isolation or quarantine. And so we're really concerned about their health all around, their physical health, their mental health, and just checking in on them in that regard. So we do a public health check-in with them on a daily basis. If there are folks that are not a resident of Pitkin County, that's the state health department. So Colorado Department of Public Health and Environment are the ones who issue the quarantine and isolation orders, and they're doing the follow-up with those patients.
Great, thank you. Dave, we're headed back to you for some Aspen Valley Hospital questions. Should people still visit at AVH, and when should they not visit?
Thank you for that. That's a very important question. I think the community knows that right now Aspen Valley Hospital has restricted access. And that's for a very specific reason, and that is to protect our staff, our physicians, and our patients so that we can be there and be ready to provide the essential services that we do. But make no mistake, we are here and we're ready to serve this community and all of its medical needs. That's what we do. That's what our community expects us to do. But right now, we need to focus on urgent medical needs and diagnostics. So in fact, for elective purposes and reasons that medical care doesn't need to be provided right away, we really would rather not have the community come to our hospital. Because again, we want to preserve the hospital and all that we do for when our patients need us. So today, actually, we have postponed our elective surgeries, those surgeries that don't need to be done right away, and have we've notified our patients, or in the process of notifying our patients, that we want to at least hold off for a couple weeks and then reassess the situation. Similarly, with our other clinics at all of our locations, including the hospital, and our outpatient services, diagnostics, etc., if it doesn't need to be done or performed right away, if the patient can wait, that's what we need to do. So we're there for the people that need us now, but we would really request that the community not come to the hospital for purposes other than that. And that comes back to our emergency department and those that think they have the virus. If they can stay at home, self-isolate, and take care of themselves like they would any other condition, that would be the best thing to do for ourselves. And it's important to note for our patients as well and for our community. You don't need to be going out of the house and don't need to be coming to a public place if you don't have to. So it's in everybody's best interest that the hospital be reserved for those that need us the most.
We did get a question about if there's plans to expand your facilities if needed. I think there's a capacity question about what you can and can't take on.
That's also a very intuitive question. Yes, we are limited. We do have limited capacity, limited resources. However, our team has been working very hard to establish surge plans, which would be intended to address what we would expect to be respiratory conditions that again need hospital care. And so we have the facilities necessary to take care of that. And I think it's also important to note that for some patients that require mechanical ventilation to support their breathing, we're likely to send those patients to a higher level of care at a lower altitude. And that's where they're better served. But for those patients that can remain with us, one of the first considerations we have when we're talking about COVID patients is that we need to isolate them from our general population, and we need to protect our staff and our physicians. So our staff and physicians will wear personal protective equipment, PPE, that may be a little bit off-putting when you see somebody approach you with gowns and masks and everything else on, but I think everybody understands that that's to protect them and allow them to be available for the next patient. We also have negative pressure rooms. These are otherwise known as isolation rooms, where we keep the contaminants in the room and not spreading. We have 4 on our main patient care unit and 4 in our ICU and 4 in our emergency department. Those are going to become, in a sense, the rate limiting factor. Those are the rooms that are likely, if we really get pressured, to fill up. But we do have plans in place to be able to prioritize our patients and deal with the surge. But it could become very difficult. So I'd just like to bring us back to our public health order and the importance of flattening the curve, because we are downstream from everything that happens at the community level. So the more as a community we can prevent this illness from spreading and becoming exacerbated, the less pressure we're going to have on our healthcare system.
Great, thank you very much. I'm actually going to move now to questions about the airport that we got in. So what is the airport doing to mitigate spread? And this is to you, John.
Thanks, Tracy. Not to sound like a broken record, but social distancing. That is the order of the day. Obviously, that is a more challenging environment to achieve that in. We are focusing especially on opportunities for social distancing for our most vulnerable populations, while also facilitating folks leaving our community and going back home. The airport itself is taking the basic measures of increased cleanings, sanitation. There's additional sanitation facilities for hand sanitizing and that sort of thing. Employees do have personal protective equipment. And we expect that over the next few days, the load factors and pressure on that facility, just because people are going to be moving out, obviously, the reasons that people come to visit our community are less right now, so we're expecting fewer folks to be coming in and for that facility to be much less busy, as it often is in the off-season.
So there's a question about, is anything being done at the airport to screen individuals?
Yeah, so within the air system there is, particularly for international visitors, everyone who is arriving from an international destination. And by the way, many of those have recently experienced travel bans, and so we are not going to be receiving non-U.S. citizens, visitors from Europe and other parts of the world. At those ports of entry where international visitors have their passports are checked and such, everyone is being screened for symptoms of COVID-19 before they are allowed to travel elsewhere in the system. As far as screenings at our airport, we do not have employees doing individual screenings. However, we do remind the traveling public, whether that be our visitors or our residents, that if you have any symptoms, cold or flu-like symptoms, do not travel. Do not put others at risk. And so we are reminding our travelers, our hotel community has been very cooperative in pushing those reminders out. We're pushing those reminders out at the airport, and we need people to be responsible.
Thanks, John. I'm going to move it over to Gabe, speaking on behalf of the incident management team. And there's questions coming in about essential services. Will water and power stay on? Will our Aspen Police Department and sheriff's teams show up? And kind of help us understand where we're sitting in that realm.
I do think that's a very important question. Certainly, it's one of our primary objectives as an incident management team to make sure that those services remain operational. So I am here to say that all of those essential services will remain operational through this. The only differences that you may notice are some shifts in the way that public services respond. So let me just give you a couple of examples. Our goal is to make sure that the health and safety of our responders is paramount. So you may notice that some non-emergent calls with the Sheriff's Department and APD, Aspen Police Department, and Aspen Ambulance, Aspen Fire, some of those non-emergent calls may be triaged a little bit differently to make sure that we provide for that responder safety. For example, for the law enforcement agencies, some of their minor theft reports, normally they would send an officer out to talk directly to the individual. This time we may actually call first and see if we can get all that information quickly over the phone and not need necessarily a face-to-face interaction. For our EMS services, there may be times that when we arrive, our initial assessment of a patient would be at a little bit more of a distance than we normally do. It may be at 6 feet plus as we do an initial assessment. You also may notice that for both the police officers, deputies, and medics, firefighters, that we may also be arriving in a little bit different equipment. Normally you're used to seeing us in a normal uniform. We may arrive wearing gowns and masks and gloves as opposed to just the uniform. So again, our goal is to ensure the safety of the responders so that they can respond to any of your needs and continue that response as we have, all along. So I would echo, though, Mike Kaplan's comment about being safe on the mountains. We know that we're certainly an outdoor community, and certainly that's good for the soul just as much as it is good for clearing COVID. But one of the things we want to remind you is that the ski company normally has ski patrol within the mountains. And as we move into a period of closure, those resources, those on-mountain emergency resources, which are absolutely amazing and are with us till the last snowflake normally, won't be available. So as you are in the mountains, we ask you to take just a little bit more care, maybe take a little bit less crazy line, and certainly think about that as you're going. We certainly want you to get out, but we want you to be safe doing it. Thanks.
Thank you, Gabe. Karen, I'm going to kick this back to you, and we're going to get close to wrapping this up. But, what can people do to help?
Yeah, thanks, Tracy. And I think when you started this, kicking us off of sort of the individual role and the community role, organizational role, and policy role, I just want to really bring it back to echoing probably what John said as far as, this is a big impact to our community, and we need a full community response, and that's at every level of the community. So we can do a lot of things from a healthcare or a public health perspective, an employer perspective, but it also comes back to how we can just be neighbors to each other and recognize that this illness will potentially impact your neighbor, family, or friend at some point. And so how can we just have a compassionate and empathetic response in our community to folks who might get sick, or to just basic pieces around all the rallying that's been happening, all the heartwarming stories I've been hearing about providing kiddos food when they're not in school, and seeing neighbors reaching out to neighbors to pick up medicines for them, and how we can really rally as a community to have a community response to the illness as well as just a positive aspect. And I just think it's unprecedented, right, where we're at right now. This is a global pandemic that none of us have ever experienced, and to remind everyone that we really need to keep our infrastructure in place. That includes our healthcare and our first responders. We need to make sure that the most vulnerable aren't getting sick so that we don't have mortality in our community. And we need to take the steps to do social distancing and really support each other in that. And that's a social movement, right? We remind people, stay your distance. It's pretty basic, but it's a cultural shift for us. And I think just for everybody to join in on that cultural shift and understand that We will get through this. It's going to be a little bit of a long haul. If we flatten the curve, it makes the duration of COVID-19 in our community a little longer, but we don't implement spikes in that epidemiological curve where we have a huge number of cases right away. That's going to override our system. We need to keep our infrastructure intact to get through this. And so we all play a role in that.
We do. Thank you for that. I think it's important, too, to note that we are kind of a small but mighty team, right? And just to let our community know that we might not be getting back to them as quickly as we'd like to, but we are working on that. We're trying to put systems in place to support all the questions that come in, but there's a lot of things you can do to find information. And I'm going to share with you, we haven't decided that we're on a consistent schedule for the community meeting. I really appreciate y'all being here today. I think they were great questions and really great response. But if you haven't signed up through Pitkin Alert and you're here local to get the information that we're sending, that's a great thing to do now. And so I'm going to share with you again, that is you text to 888-777 the word C virus into the message line, and that gets you into, again, our system that's sending out as much information as quickly as we can when we have it. Recognizing that, again, the information coming to us quite often from the state is very dynamic. And so just know that that's a good place where we see it. We also, John hit it a lot, but we've got that community hotline set up that, again, is prepared to answer what they can when we have information, and that was 970-429-6186. The people staffing that line are your neighbors and your friends and your coworkers. So just, again, let's kind of practice that patience with each other. There's a need for that right now. We've got lots of, businesses. I know the city of Aspen's got a web page up. We've got the Pitkin County Coronavirus website, and we're really active on the Pitkin County Public Health Facebook page. We recognize there's a need for some other social channels, but again, we're having to bring those on slowly as soon as we have bodies to kind of help us, monitor and work with those channels. So again, I want to thank the panel that was here today. I want to thank our community who's been joining us today. This will be a recorded community meeting that we'll be able to, again, to put out on our channels for you to take a look at, or go to Grassroots TV. The team that helped us with that today, we so appreciate you. We're very grateful for you turning on a dime to help us get this information out. But with that said, everybody, let's just do the best to stay healthy and safe and take care of each other. Thank you.